Hey there, it's Dr. Jess Sally again with Regenexx Pittsburgh, your Southwestern Pennsylvania premier providers of interventional orthopedics and non-operative regenerative treatments. A lot of times when we're doing regenerative procedures, we utilize nerve blocks in the area of the body that we're treating to help with reducing the pain sensations that go to that area to, number one, make treatment more pain-free as we're instituting the treatment, and also just to help with people having soreness or reducing post-treatment soreness and to help improve recovery after the treatment. Nerve blocks are usually delivered through injection under ultrasound guidance. We can also do injection approaches for nerve blocks under fluoroscopic or X-ray guidance. It depends on the area of the body that's being treated. When nerve blocks are being done for anesthesia purposes, we try to utilize either ultrasound or fluoroscopic guidance to place an anesthetic medication directly around the nerve itself. What that does is it actually shuts down the nerve's ability to promote pain signal. In addition to pain signal, nerves can also provide sensation and motor innervation to muscles. So some nerve blocks, depending on where they're performed, can create sensation deficits, but they can also create weakness in that area. For example, if we're using a nerve block in the neck area for purposes of treating structures in the shoulder, that nerve block may cause weakness in the arm for even up to several hours after the procedure. Usually before the procedure, we'll talk to patients about this effect and what to expect so that you can anticipate that kind of an effect happening for after the procedure so that it doesn't come as a surprise. When we're doing more therapeutic nerve blocks, we're usually using the same anesthetic, usually in a lesser concentration to inject around those nerves, but we're also using materials like platelet lysate or platelets in general to help with providing more of an anti-inflammatory effect around the nerves and helping with nerve recovery and nerve healing so that we can reduce pain in areas where people are having nerve inflammation and pain. One prime example that we use is nerve pain in the spine. When we're doing spine procedures, we're usually using fluoroscopically guided injections or X-ray guided injections to place that needle directly around the nerve root and inject around that nerve with an anesthetic and with the platelet-based injectate to help again with decreasing pain and improving function. Another example would be in the carpal tunnel, where we would inject the same materials around the nerve as it travels through the wrist underneath the carpal tunnel to help with reducing inflammation around the nerve and also helping to decrease any scar tissue or any other inflammatory factor that may be contributing to that pain and weakness extending into the hand. If you do suffer with any type of chronic nerve pain or chronic spine pain, it would be worth your time to check out regenexxpittsburgh.com or to come and see us for an evaluation so that we can look at what treatment options may be good for you and how nerve blocks can actually be helpful for reducing pain and improving your function for the long term.